Nairobi, and many other partners, UNFPA, Flying Doctors Society of Africa, and AMREF. At M-Pesa Foundation, we believe that a woman suffering with fistula should be taken care of and reintegrated back into the community. So we are not only looking at treating them today and repairing them, but we are looking at the future and making sure that we reintegrate them back into the community. So all those women who are here today, we have paid for their SHA registration. They will be able to receive continuous care even after their surgeries today, and we will also follow them up and ensure that they're fully reintegrated into the community. Thank you very much.
UNFPA? I've become the...
Good morning, my name is Pilar de la Corte Molina. I'm UNFPA Deputy Representative, and the UNFPA ending fistula is one of our key areas, and it's at the core of our mandate. It's a human rights issue. We support the Ministry of Health and key partners in the prevention efforts, treatment and reintegration, and let's not forget also that the prevention through family planning and other interventions is key, and it's also key to ensure that women access safe delivery and skilled birth attendants, so we avoid having more fistula cases in Kenya. It is estimated that around 10,000 women are already suffering from obstetric fistula, so we have a huge backlog. So we need to treat them, but we also need to ensure that we prevent future obstetric fistula. So thanks to the hospital for hosting this a very important week, where at least 60 women are already or being repaired. Of that, the efforts in prevention and awareness are successful, and hopefully we can reach more women throughout this week and next week. Thanks a lot.
Dr. I think you should introduce yourself before the boss speaks and tell us a bit more about what you've done this week.
Okay, thank you. So my name is Dr. Stephen Utiso. I'm a consultant obstetrician gynecologist, Kenyatta National Hospital. I'm also a fistula surgeon. So we have been here this week to prepare patients with obstetric fistula. It has been a busy week. We started surgeries on Monday, and we are going to end today. So far we have done 33 patients. We hope to finish the remaining patients today. We have seen patients coming from all over the country. We have patients from all the counties. So it means there's still a lot to be done to make sure we end obstetric fistula in our country. So we thank all our partners for their support to make this camp a reality. Thank you.
We'll talk about the Monday camp that you have beyond today.
So thank you very much, and you're all welcome to the Department of Obstetrics and Gynecology, Kenyatta National Hospital. My name is Philomena Owende. I'm the head of the department. Beyond this, we have a urogynecology clinic where we screen women with fistula, and so the care continues even after this camp. Thank you very much.
AMREF? Amanda, you are? AMREF, okay, great.
Yeah, thank you very much. We're here to be part of this ecosystem. Your full name? My name is Kennedy Wakoli. I lead the Integrated Fistula Program at AMREF Kenya Country Office. As AMREF, we are part and parcel of this ecosystem to ensure that we restore dignity for women. And how we are doing this, we are supporting the Ministry of Health, working close with the M-Pesa Foundation and UNFPA to ensure that we routinize maternal health services as part of the efforts to ensure that we provide quality services that will reduce the incidence of fistula in the country. Thank you very much.
Okay, we come to you now, final.
Yes, good morning everyone. My name is Dr. Desan Joel, Senior Director Clinical Services at the Kenyatta National Hospital, but today I'm acting CEO as well. So first of all, welcome all of you to Kenyatta National Hospital. Also welcome our partners who have joined us today on this important exercise on women care. Kenyatta National Hospital is the biggest referral hospital in this part of the world. It's in association with the University of Nairobi. We carry out the mandate of teaching and treating as well. Teaching in the sense that in adventure like this, we get here sometimes because we do not have adequate personnel who can take care of these patients out there. So as a university and the teaching hospital as well, we train both nurses and doctors who will go out there and be able to provide services, particularly to prevent this kind of condition happening. But in an event that eventually does happen like now, we do not give up. We indeed, as a leading hospital, have got expertise and adequate personnel to attend to this kind of situations. And in this particular week, we set it aside, not only for the repairs, but to create awareness, particularly for those who may be suffering with this condition, but they've got nowhere to go, or no one who knows what needs to be done for them to get a dignified life from the positions where they are. We are aware that it will affect people who are already marginalized by other conditions, a mixture of things, either financial, either lack of knowledge, either lack of transport, or at times, even when it is known, absence of skills to attend to it. So as Kenyatta National Hospital, we come in every day, but in particular this week for those particular 2 exercises, to take care of our women and restore the dignity that each and every woman must have, each and every Kenyan must be proud of. So we are indeed privileged to have our Weshiniwa here today.
Absolutely. Yes. Introduce yourself.
All right.
Well, apparently you can't
Thank
hold
you.
it.
Thank you so much. Okay. Right, I'm Dr. Lois Nyanjao. I work in the Ministry of Health in the Division of Reproductive, Maternal, Newborn, Child and Adolescent Health. And in that division, I lead maternal health programming. And this day is very special to us because it really signals what is the final outcome of the care that we provide. As Dr. has just said, the quality of care, all the way from the community into the facilities, may contribute to the occurrences of this fistula. So we are, as a ministry, very eager and very keen to make sure that we build capacity within our counties and even private sector, these providers, to have the right skills to manage a woman who's pregnant during their labor and the period of delivery and postpartum, so that they don't develop this fistula. So as a ministry, we are happy to really collaborate with our stakeholders who are here with us so that we can pass the message that we want to prevent this fistula, but in the event that it occurs, care is there, and we are very, very, very supportive to we are very supportive to any families that may be suffering this condition. Thank you so much, and we look forward to the rest of the day.
I need to ask a question. Right now, we know, like Sharon's case, Sharon got fistula because she gave birth, right? And she had the tear. What I want to know, right now we have a crisis with teenage moms. How much of early sex, defilement, early birth, children like 10, 12, 11 giving birth, how much does that contribute to fistula?
Yes, teenage pregnancy contributes to fistula because development of the pelvis takes time. So to achieve full maturity, at least one has to be 18 and above. So if you have a teenage pregnancy is happening much earlier, 12, 13 years. These are still children. The pelvis is not well developed. It's not good enough to allow passage of a baby safely. So this actually contributes. You end up, these young girls end up with prolonged labor. They labor for several days, and if they don't get assistance as quickly as possible, then they can end up with obstetric fistula.
Rape and defilement?
Rape and defilement also does contribute. You can try and imagine, for example, for young girls, they are still immature and they are being raped by adults, a lot of force and things like that. This can actually cause injury to the bladder, injury to the rectum, and also injury to the reproductive organs. And this can also cause
Tell me, can this also happen during cesarean? A mistake in the cesarean?
Yes, sometimes we have a group of fistulas which occur after surgery. Sometimes it does happen, maybe when the delivery is complicated, and you find probably maybe it's a bit difficult to identify properly the structures. So this kind of injuries may happen sometimes during some of our interventions.
So now, what are the signs? How would a woman know that she has fistula?
The common signs for fistula is leakage of urine or stool uncontrollably after childbirth. So if these symptoms are there, the woman most likely has a fistula. So the event must be delivery, and if you talk to them a bit more, you'll find probably the labor took so long, maybe several days, or there was an intervention, for example, like cesarean section. So if the leakage of urine starts after delivery, then you suspect that the woman has a fistula.
Tell me, how long will screening be today? Today is the last day of screening. We've had screening from Monday. Of course, because of the fuel strike, many women did not make it, but over 100 women have been screened, 60 booked for surgeries. Today, the screening is continuing?
Yes, screening is continuing today, and then...
Up to what time? Because maybe there's somebody watching us live right now who might decide to come.
We'll have screening the whole day.
The whole day?
Yes, yeah. And then... Yes,
Closing at 5, and then, of course, every Monday.
Yes, yeah, every Monday.
Every Monday morning. Every Monday morning. Okay, so to do... I'm just going to hold it. Huh?
Kenyatta National Hospital is a referral hospital. It's a referral hospital that's got also a call center.
Yeah.
The call center is available
24/7.
24/7, wherever you are, whenever you need any services from Kenyatta National Hospital. This is a line you can reach. And once you reach the line, you'll find a doctor on that line, and then the doctor can take over the directions and the management. If you are not within Nairobi, you may be directed to go into a facility near you, and then Kenyatta National Hospital can liaise with the facility near you to get you to the nearest facility. On the western part of the country, we have Moi Teaching and Referral Hospital. We can refer you there. Our counterparts can take care of you there. If you're nearer to where we are, equally well, we'll take you up.
Makweni as well in
Call
water.
center number? It's on the t-shirt. Call center number. Or give my phone. It is on the flyer. Yeah, give me my phone.
Flyers.
Who has my phone? I have the call center number on the flyer. You should clear it.
It should be available in the public. I don't want to say it because I know it.
Oh, good. Let the chairman come. We ambush him. Put him on the...
No, he just say hello for now. Okay, make his speech later.
Okay, is this the one?
No, this is
Ministry of Health. This one.
The toll-free number
Ah.
for screening.
For screening?
Yes.
Is this going to be available, Sharon? Is this going to be available even after beyond today?
Yeah, Mr. has said we can be able to do it even on every Monday.
Yes.
Yeah, every Monday, so that we can be having continuous screening.
The number is right
Okay, so for inquiries, there's a toll-free number, 0800 722 600. 0800 722 600. We'll put it at the bottom of the post. Okay, so all this. Right. So for me, I'm so proud of our country. You know, we need to celebrate Kenya and everything that we've achieved. We can't always just look at the negative. We also have to look at the positive. Today, the lives of many women will be changed because they've had the surgery and they're going to walk out of here with the dignity that they deserve, having suffered fistula for many years. And marriages will be restored, according to Sharon. Yes, because sometimes men leave their wives because when you have fistula, sometimes you have a foul smell and the men just run away. Okay, so if you find that your wife needs attention, she needs medical care, and she probably got fistula because of bearing your child. So you can actually bring her to Kenyatta National Hospital today for the screening. If she is positive for fistula, then she will be taken in for the repair surgery, and then she'll walk out with the dignity and be able to continue her life properly. So for me, it's all the partners, M-Pesa Foundation, AMREF, JPEGO, UNFPA, all the partners that are working together to actually ensure that we restore dignity to the women that have got fistula. So as Kenya, Fistula Day is celebrated on the 23rd of May. We're celebrating it today because tomorrow is a Saturday. The whole week they've had a camp and women have showed up. So please, if you think you are suffering from fistula, then come to Kenyatta National Hospital, find us on the ground, get screened, get scheduled for a surgery. It's all being covered by SHA. And for me, I celebrate the fact that Kenya is getting ahead in restoring the dignity of many women out there that require fistula surgeries. I want to thank Kenyatta National Hospital. Every time I come here, you're improving and improving and improving. And for me, I mean, I always say that we do end up with hitches once in a while, right? But at the end of the day, you do so much for our citizens, and we celebrate you and your entire team. All your doctors, your nurses, your cleaners, everybody that works in KNH, we celebrate you today.
Thank you.
Chairman. Yes, I hear he's passionate about.
Mheshimiwa, thank you very much. I don't want to say much. At this stage. The M-Pesa Foundation has been doing this kind of work right around the country, and we are very proud to participate with Kenyatta this time. We've been here doing other things as well. It's not the first thing we're doing at Kenyatta National. But we can talk about fistula and our participation in this corrective work a little later in the process of speech making. But we want to see even at this stage that we are very grateful to Kenyatta for allowing us to do this with them and with all our other partners. It's a big job. It can be handled by just one institution or one organization. So we are very happy. And also, of course, very happy to get your support. And we need a lot of support, both social and economic and political, out there. And the appeal that you've just made, I think I would like to add a strong point that anybody that knows anybody that may be suffering from fistula, because it's the kind of condition that people hide, and it takes time to find out the suffering. So anybody that knows anybody that can benefit from corrective surgery in this respect, please let us know. We'll go and look them apart, we'll go and find them and bring them to a place where they can have.
Thank you, Chairman. Thank you. We all celebrate M-Pesa Foundation and everything that they do. I understand that we're standing here on a ward that you're renovating right beneath our feet. Yes. So we're going to look forward to that launch of that day. You're doing an amazing job for education, for health, for empowerment. M-Pesa is part of our bloodline, so we celebrate you. If I don't let the chairman of NGAF speak, I'll be in trouble, because NGAF has given some money. NGAF is the National Government Affirmative Action Fund. They gave some money for the t-shirts, the water, the sodas, the media coverage. So I think you can say something as the chair of NGAF.
Good morning, everyone.
Good morning.
My name is Jared Aminga. I'm the chair. My name is Jared Aminga. I'm the chairman of NGAF Fund. NGAF is the National Government Affirmative Action Fund that deals with the vulnerable in the community. Our mandate is to deal with women, children, and people with disabilities. So we are happy today to partner with all the partners present as NGAF Nairobi to make this day a success so that our women can be helped. Thank you.
Okay, I think now you guide us on the patients and what can be covered, who's giving an interview, so that we don't infringe on anybody's rights.
Actually, all of them have signed.
You're just giving it.
Sorry.